Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 14 of why you can still have back pain. In this video, hidden secret number 14 is due to arthritis. Arthritis literally means inflammation of the joints. The word arthro, is Latin for joint, and the word itis is Latin for inflammation. Anytime you see the word itis, whether it's hepatitis, which is inflammation of the liver, or laryngitis, which is inflammation of the larynx, or dermatitis, which is inflammation of the skin, anything that ends in the word itis means inflammation. So with arthritis, what we're dealing with is inflammation of the joints. Now there's a lot of different types of arthritis, but the two broad categories of arthritis include rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune disease. And what's going on with that is that your body's immune system, and specifically your white blood cells, are attacking the joints and causing destruction of the joints. And you may have seen this. This is very, very common with the elderly, where you may have seen elderly people with disfiguration of their hands, where the knuckles are bent and swollen. And it looks like they're just very, very racked with arthritis, and that's very commonly rheumatoid arthritis. Rheumatoid arthritis can also affect the spine. Now, nobody really knows what causes autoimmune disease. We believe that there's a genetic factor, and we also think, based on the literature, we think that there's something that happened during the course of your life, some kind of a trauma or an illness or something that just changed your genetic expression, that turned on a switch that caused your body's immune system to start turning on your own body. And that's rheumatoid arthritis. The second type of arthritis is called osteoarthritis. Osteoarthritis is also referred to as old age arthritis or wear and tear arthritis. This type of arthritis is caused by long-term abnormal position of the spine, or if you have repetitive trauma to the spine, such as multiple sports injuries. A lot of professional athletes get this. Professional football players who collide with other football players over and over and over again. It's like being in a car accident every single week. And that causes a breakdown of their joints and leads to inflammation, ongoing destruction of the joint, leading to arthritis. And another cause of this could be due to abnormal posture or a loss of curves in your spine. People that, if they dive into a swimming pool and hit their head on the bottom and they buckle their spine, over a course of decades, that can lead to breakdown of the joints. Or if they were involved in multiple motor vehicle accidents resulting in a whiplash trauma, causing damage to the joints, that can lead to arthritis later on down the road. Now, there's a lot of different ways to treat arthritis. The medical treatment of arthritis involves the use of pharmaceuticals, and they commonly prescribe a couple of different things. One of them are called COX-2 inhibitors. COX is cyclooxygenase, and that's a precursor to a chemical called prostaglandins that's pro-inflammatory, and it can cause not only pain but continued arthritis and breakdown of the joint. COX-2 inhibitors include things like Vioxx, Bextra, and Celebrex. And as you may recognize, two of those have been pulled from the market because they can cause cardiovascular problems leading to heart attacks and strokes. Another thing that they use, the medical doctors use, are called NSAIDs, which are called Nonsteroidal Anti-Inflammatory drugs. Now, these nonsteroidal anti-inflammatories include things like ibuprofen or Motrin, and naproxen sodium or Aleve, and also aspirin. Another thing that they prescribe is high-dose Tylenol. Tylenol is not considered an NSAID, but it is there for pain relief. Now, the problems with using these medications is that they're nonspecific. They don't really go after the root cause of the problem. They just mask your symptoms. And also, they're very toxic, and they're very damaging to your internal organs, including your liver, your kidneys, your gastrointestinal tract, and your brain. They are designed, most of these are designed for short-term use only. But the problem is people that have arthritis have constant ongoing pain. that interferes with their abilities to do their activities of daily living, such as yard work or playing a round of golf or picking up a bag of groceries. They just are hurting so badly that they feel compelled to take something to help with the problem. But the pharmaceutical approach, again, is designed for short-term use, not long-term. And overuse of this over a long period of time, again, can cause damage to your internal organs. So be very careful with that. There is a couple different nutritional things that you can do that are not harmful to your body. It can provide tremendous amounts of relief from arthritis pain, both rheumatoid and osteoarthritis. And some of these include the use of taking fish oil supplements. Fish oils have fatty acids, and specifically omega-3 free fatty acids, which are anti-inflammatory in nature. People in the United States generally don't eat enough fish to get sufficient amounts of omega-3 fatty acids. And because of that, the people in the United States have a lot of chronic inflammation going on, which can manifest as arthritis. So taking fish oil supplements can really help. For general wellness, I recommend 1 to 2 grams of fish oils per day. And you have to be careful, though, if you're taking any kind of anticoagulants like Coumadin or warfarin. If your doctor has you on those, you have to talk to your doctor first before you take any kind of fish oils, because that can cause a problem. Another thing that you can try for arthritis is a supplement called glucosamine sulfate. Glucosamine is a simple sugar molecule, and what it acts like is kind of like WD-40 for your joints. It acts as a lubricant for the joints and allows your joints to move better with less inflammation and less restrictions. It's very powerful, and it does work. You have to be careful, though. You have to use the correct dose, and you have to use a product from a good quality company. Taking something from the dollar store or Sam's Club or Costco probably is not good quality. So you want to make sure that you're using something that's of good quality, something you can find in a doctor's office or a nutritionist's office, as opposed to like the dollar store or the local grocery store. The products from those places generally aren't very good. And finally, you want to also make sure that you're exercising and getting plenty of movement to your joints. That may sound kind of counterintuitive because it kind of hurts to move, but at the same token, if you're not moving, it's going to make the problem that much worse. There are certain exercises that you can do that probably aren't going to hurt you too much. The best one for people with arthritis, in my opinion, is swimming. Going to a local pool with a YMCA or a local gym and swimming will allow you to get a full range of motion workout without putting stress on your joints, because you're in a buoyant environment in the water and it's not pounding exercise. And if you can't find a pool, then biking, either using a stationary bike or going outside and riding your bike for an hour. That's very, very good exercise. It'll keep your joints moving and keep you limber. If you're still having problems after trying the nutrition approach with the fish oils and the glucosamine, and you've also tried swimming and exercise and bicycling, and you're still having problems, you might want to go get professional help from a chiropractor. In my office, what I do to help with arthritis is a procedure called mass correction, and MASS is an acronym that stands for motion, alignment, and strength. It's specific to my office, and what we do is we restore movement to the joints and the muscles, then we realign the spine to reduce stress on the joints, and then we strengthen the spine by giving you gentle exercises to reinforce and stabilize the spine so that your adjustments hold well. Well, I hope you enjoyed this video, and I hope you learned something. If you have any questions about arthritis or any kind of back pain problems, please feel free to communicate with me through my office. I can be reached through my website at redapplewellness.net. Please also subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.